Mr. President, and to my colleagues who are making this presentation on behalf of the people of America on health care, it's certainly my pleasure to join them and to speak briefly about what will take place if we do not pass in this insurance reform program of public option legislation. So when it comes to health care reform, we've all heard the myths that a public option would amount to a government takeover of the health care system. Mr. President, this is completely false and has no basis in the legislation under consideration by the Senate. So let's examine the facts. 45,000 Americans die each and every year because they do not have health insurance and cannot get quality care. That's one death every 12 minutes. Clearly, the system is broken. The time for action is long past. I believe we need to restore choice and accountability to the healthcare system. The only way to accomplish this is with a public option. It would increase the availability of care. It would help fight the disparities that plague our current system. At the moment, the people of color represent half of the nation's uninsured, even though they make up only a third of the total population. A low-cost public option would meet the needs of these who are at a disadvantage, regardless of background or skin color, Mr. President. And a public option would restore competition to a market that is currently monopolized by only a few corporations. Take my state, for example. In the state of Illinois, two companies dominate 69% of the insurance market. That's why their profits are growing 4 times faster than wages. Mr. President, this is unsustainable. It is breaking America's businesses and bankrupting American families. And we talked about the businesses here earlier. My colleagues have mentioned what this do for small businesses. And we must make sure that there are choices, even for them to have an exchange where they can. Small businesses can shop for their insurance. But if these companies have to compete with a public plan, every premium will go down. It'll bring about competition in the marketplace. And if you like your current insurance providers, nothing will change except that you'll save money and you won't have to worry about losing your coverage when you really need it. So no government bureaucrat will alter your insurance plan, your doctor, or the level of care you receive. But if you can't afford insurance or your coverage has been denied due to a pre-existing condition, you will be able to get quality care at an affordable rate. Just like any business, a non-for-profit public insurance option would require some initial capital to get off the ground. But afterwards, it would rely on a premium it collects to remain self-sufficient. The current system is a drain on the American taxpayers. A public option would not be. Public option would complement private insurance providers, not, and I emphasize that, Mr. President, not drive them out of business. In fact, it will result in an increase of 1 to 3 million additional customers for private companies. In other words, by bringing all those persons into the coverage now, insurance companies are going to benefit where all these uninsured people now being covered. And there will be no government takeover. There will be no death panels, no rationing, and no red tape between you and your doctor. Mr. President, it's time to reject these myths and to take decisive action. The only way to achieve meaningful health care reform and bring costs down is through a public option that creates real competition in the system. And let it be clear to all of my colleagues in this august body, I will not vote for any health care bill that does not include a public option. With that, Mr. President, I yield the floor and yield back my time to the distinguished senator from Colorado.